Hi, I'm Dr. Todd Lizon from Lifestyle Integration. Today I want to speak to you about exercise and exercise mimics and the effects that they have on depression. And most people might have heard that exercise is medicine, but I really don't think that most people truly believe that exercise can have as much of an effect or maybe even more than the traditional ways that we deal with depression. Here are some of the stats. So with antidepressants, about 50% of people that use them will get some sort of clinical significance, but the dropout rate is about 26 to 28%. With psychotherapy, there's a small to moderate effect when you look at the literature, but again, there's a dropout rate issue of about 19%. Now, when we look at exercise and its effects on depression, there are two things that we want to look at because it also does one extra thing. The first thing that it does is it decreases the odds of you ever even developing depression by at least 22%. And the second thing, from a treatment perspective, a couple of things they found in the literature, and that's that one single session can have a benefit. And in addition, there are large benefits to exercise that can exceed traditional treatment, meaning the depression, meaning the antidepressants or the psychotherapy. So exercise, when we look at it in the literature, can have a huge benefit. But again, it doesn't work for everyone, and there can be a dropout issue of about 18%, which is still less than the dropout rate I mentioned before with psychotherapy of about 19%. So I've got a really cool hack for you at the end of this video, but first I want to speak to you about the exercise mimic that I mentioned a little bit earlier. And the exercise mimic is the use of a sauna. Now, saunas work on depression in a few ways. The first way is that they decrease the inflammation that is often associated with depression. The second thing is, in a study they found that one single sauna session had an effect on depression in a positive way that was noticed within 1 week of the session and lasted for up to 6 weeks. This is actually similar to what they found with the exercise, where one single exercise session could also have an effect on depression. And finally, there are other studies in the literature that show that sauna use will help with depression. So we know that sauna is an exercise mimicker because it mimics exercise by raising heart rate, raising blood pressure, temperature, sweating, and that sort of thing. So it's a great tool to use if you are a little bit incapacitated, can't get out, won't exercise, have a few issues with knees, etc. A mimic of exercise can sometimes be helpful for depression. And finally, I want to talk about this biohack, because a lot of people love their biohacks. Remember how I said that not everyone responds to exercise therapy. In the research that's been done, they found out that this thing called brain-derived neurotrophic factor, or BDNF, is an indicator as to whether you have success with exercise therapy or not for depression. Meaning, if your BDNF levels are higher, the exercise therapy will work for you. If they're lower, it will tend not to. So the hack is this. Sauna therapy, a single session, increases your BDNF by up to 66% after 20 minutes. So it would make sense, theoretically, that if you're using a sauna regularly, your BDNF levels will be higher, and then when you take part in exercise, you'll have a better response, more effects when it comes to your attempts to work with your depression symptoms. So the biohack is sauna therapy may help with your exercise, and all of these things overall may be more effective than the traditional methods of antidepressants and psychotherapy. So there you have it. If you have any questions or thoughts, by all means fire away some comments. Until next time, I'm Dr. Todd Lizon. Keep well.